Hello guys, I am Dr. Peter Gashe, an associate dentist at Family Health Dental Clinic, and I would like to discuss something called whitening. Now, whitening is a very big term to mean that you want your teeth to look better, more brighter shade of white than they are, and we have different types of whites or shades of white. Now, when you approach your doctor and you want to whiten your teeth, it only means either you have discolored teeth or the shade of white that you want, or the one that you have rather, is actually not what you want. Most of the people who comes to us wanting whitening is because their teeth are discolored. And earlier on, I've given a clip talking about dental fluorosis, and in that clip I've mentioned different types of whitening, and that includes direct masking, indirect veneers. I've also given a brief touch on crowns. And today I want us to talk about veneers. Now, what are veneers? So we have two different types of veneers. First of all, we have the indirect veneers and we have the direct veneers. The most common and the most affordable veneer is the direct one. So that basically means that if you have discolored teeth, your dentist is going to try and scrape off a just thin layer of your tooth, or the layer that is discolored, and they are going to be able to cement with a brighter shade of white, just like in a filling, but now this one is done with different or special filling materials called tooth colored materials. The name given to them is composites. And now we have the indirect veneers. So the difference between direct veneers and indirect veneers is direct veneers are done inside the clinic with your dentist. Indirect veneers, the preparation is done. Preparation means that on your tooth that is discolored, for example, this is the crown. We just want to remove a very small amount of the discolored layer of a tooth, 0.5 to 1 millimeter. Okay, and now we replace that with a white filling, that is direct veneers. Indirect veneers is we do the same process, but now instead of putting our filling on the dental chair, we have to take the measurement or measure the amount of tooth layer we have removed. We send that to the lab. They are going to fabricate a very thin shell with a special material called porcelain, and then that one is the one that we come and cement onto your teeth. And it's very aesthetic. It's quite expensive. The advantage with that, it doesn't discolor like direct veneers. It's more durable. The other option of whitening is crowns. Now, crown, you will have to now prepare the entire tooth, including the inside. Veneers, it's only outside, but for the crown, it's actually the inside. So we come and just fit and cement that preparation onto your teeth. So please visit your dentist, ask them about options of whitening. They are going to be able to evaluate you and be able to know which best suits you. Alternatively, you can also approach us here at Family Health Dental Clinic and we can help you whiten your teeth.